Namaskar and welcome to the official podcast series from Ministry of Health and Family Welfare, Government of India. This series is the part of Tobacco Free Youth Campaign 3.0, where we are empowering young generation to say no to tobacco and yes to healthier and brighter future. Today we are honored to have Dr. Professor Shalini Singh, Director of National Institute of Cancer Prevention and Research, Noida, ICMR. She is a leading scientist of preventive oncology and public health. She has been in the forefront of India's initiative of tobacco control and cancer prevention with women's health. Welcome, ma'am. Welcome to coming to this podcast and having this important conversation with me.
Thank you so much. It's really important that we discuss this issue because it's a growing problem and we need to protect our country, our youth, our people from this tobacco menace.
I totally agree. So I'll start with my questions directly. So my first question would be, what are the most common health issues that you see, that you encounter in your practice day-to-day basis that has started from a tobacco use?
See, it depends, tobacco actually affects all parts of the body,
Okay.
beginning from head to toe. From head, you can say that, it's the stroke, brain stroke that as it's called. It affects your eyes. You can have sudden blindness. It affects your ears. You can reduce, the appreciation of sound or what is called deafness. It alters your sensory organs like your nose, your mouth, the taste buds. You look at any organ, it'll affect the organ. Most people know about cancer, but they also don't know that, cardiovascular diseases like heart attacks, hypertension, high heart rate, even diabetes, cancers are of course there, asthma, lung health, tuberculosis gets flared up, any kind of disease, and you can see that if person uses tobacco or nicotine, anything and everything gets worse. Even it affects immunity of your body. Most importantly, the skin, hair, and erectile dysfunction in men, fertility in women, all these are affected by the use of tobacco.
I think there is a misconception. लोग कहते हैं कि mouth freshener use कर रहे हैं, which are like some flavored mouth fresheners. They are not actually using tobacco. So, is this a misconception or misinformation? What is this?
See, mouth fresheners, if they do not contain nicotine, they are a separate matter. But in case they are containing tobacco or nicotine, then they fall into as a nicotine or a tobacco product. So what the industry does is that it makes, because tobacco taste is very harsh, nobody can ever use it and nobody can ever like it, in the beginning at least.
Yeah.
So what they do is they add flavors to it. So for children, for instance, they add fruity flavors.
Right.
Then for the youth, they add menthol, because menthol is associated with coolness.
Yeah.
So just to mask the harshness of tobacco taste and smell and everything of that kind. So a lot of countries have actually banned flavors with tobacco. So that again reduces its attractiveness. And that's a step towards actually reducing its appeal to the youth and to the children.
You talked about nicotine. So how harm nicotine is?
Actually, nicotine is a very toxic substance. It's actually a pesticide. It has been used as a pesticide. It's a poison. It is a listed poison.
Really?
Yes. But this fact is never going to come out, because if you understand, in 1964, the Surgeon General in the US, he mentioned that nicotine tobacco causes cancer. Following that, subsequently, efforts were made to actually reduce the tobacco use, and here we are talking about it as a podcast and trying to influence our youth not to use tobacco in any form. So nicotine is the substance which actually perpetuates the addiction.
Okay.
It's the substance which causes cardiovascular events like I just mentioned, heart attacks, hypertension, high heart rate. All these things are caused by nicotine.
So tobacco is harmful because of nicotine?
It's the addictive substance.
Okay.
But tobacco products,
Okay.
tobacco is got from leaves
Yeah.
of tobacco plant. But the tobacco products just don't contain nicotine alone. They contain several other substances, like the nitrosamines, they contain heavy metals, they contain a lot of things. Because in the process of making those tobacco products, actually they undergo a lot of processes. So thing is that nicotine is the product which actually perpetuates this addiction. And then other things are added for attractiveness, like I mentioned, the flavors, the menthol, these kind of things. Then the other things are additives. They are like sweeteners. Then they are like products which reduce the, rather actually they help promote absorption of nicotine faster. So they change the pH. Then there's moisture. Because of that, it's easily absorbed into the bloodstream. So these are additives. So tobacco products contain all these kind of different things.
You're talking about the process. The process makes it harmful, relatively more harmful.
The
Am I right?
additives.
The additives.
The additives and tobacco itself actually contains the most important alkaloid, which is called the nicotine.
Okay.
The tobacco leaves. Plus, when they are made into different products, they add all these different things. So that it becomes, if it's a smoked product, to make it combustible. If it's a chewable product, to make it, easily absorbed and chewable and tasty and things like that.
So if we talk about organic products, organic tobacco products
There's nothing like an organic tobacco product. No.
Not gone through the processing.
So then there are tobacco leaves. You dry them up and you just take them.
So is it equally harmful?
Why not? See, we should not titrate harm.
Okay.
We should not say it is 10% harmful, 20% harmful. No. It's harmful. It's harmful.
End of discussion.
End of discussion.
So you said that nicotine is addictive.
Yes.
Then how harmful this addiction is, and how harmful is, let's say if one person is trying to overcome from this addiction, then how can he do that?
It's very easy. First, don't start. That's the first step. Be smart,
Yeah, I agree.
don't start. People start because of various reasons. If you start, usually the age of after 25, it is said that very few people actually start using nicotine or tobacco. So if you can give important information, correct information to the youth and to the children, then it's very unlikely that people will start. But however, tobacco industry has its, I would say, its business game, a profit-making model. So therefore, it actually advertises, uses social influencers, and all sorts of things. As I mentioned, they make it feel that it is less harmful. They'll make slim cigarettes, they'll make filtered cigarettes, they'll use menthol and various flavors and all things like that to make it attractive. So we have to guard against all of those.
And there is a misleading idea that vaping is better than smoking. What are your thoughts on this?
Definitely. Vaping has not been as old as smoking.
Yeah.
So a lot of people actually put this idea in the minds of people that it's a new product, it's harm reduction, but none of that is true. And we have seen different forms of problems with vaping as compared to cigarettes, like I would say that the lung injury, which is severe lung injury, which is being talked about in the US. There the children have this lung disease injury because of vaping, because it contains different kinds of products like glycerol and things like that. When you inhale the vapors, they cause direct injury. So apart from what nicotine does, so these are additional problems with vaping. Yes.
But vape doesn't have tobacco.
It has nicotine. It doesn't have tobacco, but it can have it has nicotine. So there are different form. The alkaloid is there. Synthetic nicotine is also there now. You don't need to have tobacco is actually connected with the leaf or the plant product, but then now synthetic nicotine has been worked out. So they are e-liquids. You can refill them in cigarettes, you know how much tobacco is contained in a cigarette because those kind of regulations have been worked out. Now for these devices, the vaping devices, we don't know. There's so many companies making different sizes, different flavors, different composition. So we don't know how much nicotine is contained in which device. It's like buying bread. You know, you'll have multigrain bread, you'll have this one, that one. So there's so many kinds. So it's not worked out. And for that, you know, you've had one cigarette. So at least whatever it was one cigarette. How many puffs you've taken, you wouldn't remember. So it's that nicotine which has gone in, how frequently, how often, all that is difficult to actually synthesize into data. So those are additional problems with vaping.
It's again is addictive.
Nicotine is there, so it has to be addictive.
And equally harmful.
Equally or maybe bad. You know, we should not, as I said earlier also, we should not compare the harms. Yes, it has, if you smoke cigarette and you do vaping, so there are studies which are coming up now that there are higher chances of stroke, of cardiovascular diseases, of lung injuries with vaping.
So if we talk about awareness, so how can we generate awareness for a healthy life among youth?
I think youth already know what is healthy. We should lead by example. We should not give them misinformation.
Like what?
Like all these kind of advertisements. We should not have social influencers who encourage tobacco use. Like in cricket matches, we've done a study on that as well. That when you watch these sports events, in India, cricket is very popular. In other countries, the racing and all those kind of things are very popular. So there, these people are actually putting out these ads. And the film industry, you know, those are notorious for promoting the sales of nicotine and glamorizing that. And the OTT platforms. So we've made, our government of India has made OTT rules for tobacco control. So those are actually exemplary. We banned e-cigarettes in our country in 2019, the PECA Act. So those are exemplary and many other countries are following India. So I think we have done great in tobacco control, but this campaign, like these podcasts, mass media campaigns are also equally required. Surrogate advertisements should definitely be banned. Sponsorships. People must follow the code of conduct, which has been actually instituted by the Ministry of Health and Family Welfare, as to how the government officials and the policy maker, they should be, you know, keep away from the tobacco industry and the influence of tobacco industry in promoting tobacco. So from the government side, I think this message should go out to all policymakers and all institutional offices and institutes.
If we talk about role of healthcare providers in generating awareness, what is their role?
So healthcare providers have different cadres. So starting from the frontline healthcare workers, like I mentioned, ASHA workers, Anganwadis, the nurses, the physiotherapists, the counselors, then there are doctors, and then there are specialists. So all and everybody can have a role in tobacco control. But what advice they're going to give, so those kind of modules are also available. And we must place a lot of emphasis on tobacco control at all levels, because this is going to drain our country of resources and of health as well. So everybody can play a role, I think.
Ma'am, what do you think, how effective these public awareness initiatives have been?
See, definitely they have been very effective because the rates of smoking have come down. We have GATS data from 2009 and 10, and then it was repeated again the second round in 2016-17, and the smoking rates have come down. However, the use of smokeless tobacco has not come down as much as it should have. There are states where it has actually gone up. So it could be because of maybe industries coming up there, or maybe there are migrant populations which have moved to those states. So it is effective because we have seen the downward trend. If you talk about early 60s, public awareness actually brought down the rates of smoking in the Western countries. As I mentioned, that the Surgeon General's report in US in 1964, it mentioned that tobacco is a carcinogen.
Yeah.
And following that, the rates have drastically come down. There are, campaigns like we've banned smoking in public places. So we have tobacco-free villages initiative. We have the tobacco-free educational institutions initiative. So at all levels we are working, and I'm sure we'll have a tobacco-free generation very soon.
I hope that happens very super soon. So what are, if I have to ask, if you have to add some pointers in these initiatives, what would those pointers be?
I think we have to tackle misinformation, and we have to tell the youth and everybody else that tobacco use is not cool. We have to have social influencers on our side who are actually misleading the public and making it sound that it's very macho or very cool to use tobacco products of different kinds. So we must handle that part very carefully, I think.
Ma'am, do you think there is a common term that is floating around in the market, that is anxiety, depression? Is it causing the usage of smoking, yes, tobacco?
It's like which one comes first, chicken or egg? So that kind of story will always be around. We must actually focus on public health. One thing leads to another, the other thing leads to the first. And both things can be cured if we remove tobacco. So that's what I would focus on.
Thank you so much for coming, ma'am, and having such a wonderful conversation. My audience and Indian government audience and the people who are watching this conversation are going to be, I think, very enlightened, and I'm hoping that they are going to tell their parents or their family, friends, and their spouses to leave tobacco as soon as possible. Thank you so much, ma'am.
Thank you very much for this opportunity.
Thank you.
Thank you.